There are 2 new cases of COVID-19 to report in managed isolation facilities in New Zealand today. The first case we're reporting today is a female teenager who arrived in New Zealand on the 13th of June and has been staying at the Novotel Auckland Airport, and she has been travelling with her siblings and her mother, who have all tested negative at this stage. Her only symptom was a runny nose. The teenager flew from Islamabad in Pakistan via Doha onto Melbourne and then into Auckland. The Doha and Melbourne legs are the same flights that one of the cases we reported last week was also on. The teenager has been interviewed thoroughly to make sure we can identify any other potential contacts and take appropriate action, recalling that everybody coming in on that flight from Melbourne into Auckland and then is going into managed isolation, so they are captured in our managed isolation facilities where they are all being tested twice. The second case we are reporting today is a man in his 30s who arrived in New Zealand from India on the 15th of June, and he has been staying at the Grand Millennium. He has not reported any symptoms at this point. The man's wife, who he has travelled with, has also not reported any symptoms and is being followed up further today. The flight the man arrived on was Air India 1316. This is the same flight from Delhi that one of yesterday's reported cases was also on. As we do with any positive cases, they have been transferred along with the people they are travelling with to the Jet Park quarantine facility. So with these additional 2 cases, our number of confirmed cases of COVID-19 is 1,163. We currently have 9 active cases, therefore, in New Zealand. One significant cluster remains open, the same one as has been previously, that is the St Margaret's one in Auckland. Yesterday, our labs completed 3,402 tests, and our total number of tests completed to date is 344,519. And on Saturday, just to give you an idea of the number of tests being undertaken in managed isolation facilities, there were 430 tests in the facilities across Auckland and 61 in the Christchurch facilities. So we can see that there is still a large amount of testing happening out in the community of people with symptoms as well, so nearly 3,000 of those 3,400 or so tests. We will update on the numbers done each day in managed isolation facilities. Now, just in terms of the picture between the 9th and 16th of June, the 16th being the day when we identified the 2 first cases, that women who had travelled from the UK last week. As you will recall, I requested that from the 9th of June, all people leaving managed isolation should have been tested, and so that I am assured that they are not a risk. And so under the current order, that means they have to be identified as low risk before they can leave. And I've asked since last Tuesday that I have made it clear that requires them to have a negative test. So subsequent to that, I had some information provided to me on Saturday that suggested that all who had left managed isolation since June the 9th had been tested for COVID-19 at the facility or subsequently. In fact, I had been given a number for the number of tests that had been taken in managed isolation facilities. So what I'm going to run you through now is a range of different numbers, but what we have done since last Tuesday to ensure that anyone who left a facility since the 9th of June has been or is being followed up. So from the 9th of June, there were 55 people who were granted exemptions, compassionate exemptions, to go into the community to self-isolate or for short-term visits, which is they leave the facility to visit someone in a hospice or a hospital. Of those 55, 54 have been followed up and have either been tested and returned a negative test. That is 50 of them. And then there are 4 who are children where it was deemed not appropriate to take a test for a range of reasons, but their family members have been tested and tested negative. remembering that this is on top of the very strict requirements that people must comply with when they are out of managed isolation. There's one remaining person where there's been initial contact, and we're following up on the ground today to ensure that person has also had a test. If not, they'll be referred for testing. Now, for the two women who arrived back from the United Kingdom and were in the Novotel Ellerslie, everybody in the hotel at the time was tested and have returned a negative test. Likewise, we've followed up all the staff, 183 who had worked there during the period they were there, and all the health staff, which is over 50, have been tested and tested negative. They're the ones who would be most likely to be in closer interaction with the women. And of all the other staff, they've been followed up and referred for testing, bar 11 whom we're working with the hotel on still, who have not worked in this last period. There were also 190 people who had been guests at the hotel from when the women entered it on the 6th of June and the 13th when they departed. And of those 119, 176 have been contacted, referred for testing, and already we have negative results on 156 of those people as of yesterday. There is currently actually, it must be now up to 179 because there are now just 11 people being actively followed up on the ground to make sure that they are referred for testing as well. This is just part of our precautionary approach, and recalling that all of these people had completed their 14 days isolation in the hotel. And finally, there's extensive work underway to contact everyone, just as an extra precaution, who left a managed isolation facility between the 9th and the 16th to confirm that they have had a test, and if they haven't, to refer them for testing, recalling that all of those people will have done that 14-day in the isolation facility. All those people, we're well in the throes of contacting all those people just to check on them and make sure they have had a test, and we expect to have completed that by the end of today. And if anyone was in a managed isolation facility in that period and hasn't been contacted by the end of today, to be checked on, there's a dedicated healthline team to call if you haven't heard by the end of the day, and the phone number there is 09 302 0408. And finally, in terms of the other cases reported over the last few days, appropriate follow-up is underway for all those cases, including, of course, making sure that anyone who was on the flight or in the same isolation facility is being tested, and they're all being captured by our around day 3 and around day 12 testing that's now implemented through all the facilities.